This medication is used to treat attention deficit hyperactivity disorder, ADHD. It works by changing the amounts of certain natural substances in the brain. Dextroamphetamine belongs to a class of drugs known as stimulants. It can help increase your ability to pay attention, stay focused on an activity, and control behavior problems. It may also help you to organize your tasks and improve listening skills. The daily dosage and optimal timing for Xelstrym 18 mg/9 Hour Transdermal 24 Patch Pressors should be determined by your doctor based on your specific condition and needs. Before using Xelstrym 18 mg/9 Hour Transdermal 24 Patch Pressors, make sure to read the medication guide provided by your pharmacist. Follow all directions in the instructions for use and learn how to properly use, store, and discard the patches. If you have any questions, ask your doctor or pharmacist. When applying the medication, be sure to do so as directed by your doctor, usually once daily in the morning, 2 hours before you need the effects of the drug. Then, remove the patch as directed, usually 9 hours later. Applying the patch late in the day may cause trouble sleeping, so be mindful of the timing. If you find yourself having trouble sleeping even after applying the patch early in the morning, your doctor may direct you to remove the patch within less than 9 hours. Follow your doctor's instructions carefully. The medication should be applied to a clean, dry, hairless or nearly hairless area of the skin on the upper chest, upper arm, upper back, hip, or sides of the waist. It's important to wash, rinse, and dry the application area before applying the patch. Avoid applying the patch to cut, scraped, burned, or irritated skin. When using a new patch the next day, apply it to a different area of the skin to avoid irritation. Do not apply a heating pad or other heat to the patch area, as this may increase the risk of side effects. If the patch does not stick properly or falls off, replace it with a new patch at another site. After removing the patch, fold it in half with the sticky sides together and throw it away as directed. Be sure to wash your hands after applying or removing the patch. It's important to use this medication regularly to get the most benefit from it. Use it at the same time each day to help you remember. The dosage is based on your medical condition and response to treatment. Your doctor may adjust your dose to find the one that is best for you. During treatment, your doctor may sometimes recommend stopping the medication to see if it is still needed. Follow your doctor's instructions carefully. If you suddenly stop using this medication, you may have withdrawal symptoms, so your doctor may lower your dose slowly to help prevent withdrawal. Tell your doctor or pharmacist right away if you have withdrawal symptoms. This medication may sometimes cause addiction, so it's important to use it exactly as prescribed to lower the risk of addiction. If your condition does not get better or if it gets worse, be sure to tell your doctor. Common side effects of Xelstrym 18 mg/9 Hour Transdermal 24 Patch Pressors may include nervousness, trouble sleeping, loss of appetite, weight loss, dizziness, nausea, vomiting, headache, mild irritation, pain, itching, or redness at the application site. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. This medication may also raise your blood pressure, so it's important to monitor your blood pressure regularly and inform your doctor if the results are high. If you experience any serious side effects such as signs of blood flow problems in the fingers or toes, fast or irregular heartbeat, changes in mental/mood/behavior, uncontrolled muscle movements, changes in sexual ability or interest, or symptoms of a heart attack or stroke, seek medical help immediately. Xelstrym 18 mg/9 Hour Transdermal 24 Patch Pressors may also increase serotonin and rarely cause a very serious condition called serotonin syndrome/toxicity. If you experience symptoms such as fast heartbeat, hallucinations, loss of coordination, severe dizziness, severe nausea/vomiting/diarrhea, twitching muscles, unexplained fever, or unusual agitation/restlessness, seek medical help right away. Although rare, a serious allergic reaction to this drug may occur. If you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. If you experience any other effects not listed here, it's important to contact your doctor or pharmacist for advice. It's important to use Xelstrym 18 mg/9 Hour Transdermal 24 Patch Pressors exactly as prescribed, as misuse or abuse can lead to serious heart and blood pressure problems. This medication can be habit-forming, so it should be used cautiously by those with mental/mood disorders or a substance use disorder. If you have a personal or family history of a substance use disorder, be sure to inform your doctor before starting this medication. It's important not to increase your dose, use it more often, or use it for a longer time than prescribed, as doing so may lead to a decrease in the drug's effectiveness, drug dependence, or abnormal thoughts/behavior. After stopping the medication, your doctor may monitor you for a while, especially if you've used it for a long time or in high doses. Be sure to follow your doctor's instructions carefully for the best results. Before using Xelstrym 18 mg/9 Hour Transdermal 24 Patch Pressors, it's important to inform your doctor or pharmacist about any allergies you may have to this medication or other sympathomimetic drugs. This medication may also contain inactive ingredients that could cause allergic reactions or other problems, so it's important to discuss this with your pharmacist. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have a history of high blood pressure, circulation problems, heart issues, mental/mood conditions, overactive thyroid, stroke, seizures, or if you are currently using alcohol or marijuana, cannabis. If you are planning to have an MRI test, it's crucial to inform the testing personnel that you are using this patch to avoid any potential risks. For long-term use, this medication may affect a child's growth rate, weight, and final adult height. Your doctor may recommend temporarily stopping the medication from time to time to reduce the risk, and it's important to monitor the child's weight and height closely. For older adults, they may be more sensitive to the side effects of this drug, especially chest pain, trouble sleeping, or weight loss. During pregnancy, this medication should only be used when clearly needed, as it may have potential risks for the infant. It's important to discuss the risks and benefits with your doctor. This medication also passes into breast milk and may have undesirable effects on a nursing infant, so breastfeeding is not recommended while using this medication. It's important to consult your doctor before breastfeeding if you are using this medication. It is important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking MAO inhibitors while using this medication, as it may cause a serious and possibly fatal drug interaction. It's important to consult with your doctor about when to start or stop taking this medication, especially if you are currently taking MAO inhibitors. Some products may contain ingredients that could raise your heart rate or blood pressure. Inform your pharmacist about all the products you are using and ask for guidance on how to use them safely, particularly cough and cold products or diet aids. The risk of serotonin syndrome/toxicity increases if you are also taking other drugs that increase serotonin. This includes street drugs such as MDMA/ecstasy, St. John's wort, and certain antidepressants. Be cautious when starting or increasing the dose of these drugs while using this medication. Do not use medications containing amphetamine or lisdexamfetamine while using dextroamphetamine, as they are very similar. This medication may interfere with certain lab/medical tests, possibly causing false test results. Make sure to inform lab personnel and all your doctors that you are using this drug. If the patch is chewed or swallowed, it can be harmful. If someone has taken too much of this medication, the patch should be removed if possible. If serious symptoms such as passing out or trouble breathing occur, 911 should be called. Otherwise, a poison control center should be contacted right away. Symptoms of overdose may include severe or persistent headache, severe changes in mood or behavior, seizures, severe restlessness, and rapid breathing. Remember, it's important not to share this medication with others as it is against the law. Your doctor may also conduct lab and/or medical tests while you are using this medication, such as blood pressure, pulse, complete blood count, and growth monitoring in children. It's important to keep all medical and lab appointments. If you are switching from another form of dextroamphetamine to this patch, be sure to carefully follow your doctor's instructions. If you forget to take a dose, take it as soon as you remember. If it's close to your bedtime or the time for your next dose, you can skip the missed dose and take your next dose at the usual time. Avoid taking a double dose to make up for the missed one. Make sure to store the individual protective pouches at room temperature, away from light and moisture. Avoid refrigerating or freezing them, and do not keep them in the bathroom. Always remember to keep all medications out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the product and it is expired or no longer needed. You can find more details in the instructions for use, or you can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.